First of all, I want to say thank you for being here. You are 4 incredibly brave women, and you're my heroes. You have been willing to put yourselves out there to address something that many people want you to stop talking. They want to prevent you from talking. Don't listen to them. Make sure that you continue to use your voice to educate us, to educate the American people, because these children are worth saving. Dr. Bowens, I want to thank you for being here. And in your testimony, you referenced what I think is one of the more important points in this debate, and that children are treated as special and a vulnerable class in the psychological and research fields. You referenced the experience of at Tuskegee, and to me, the important takeaway here is that controversial so-called healthcare practices, treatments, and experience have not always withstood the test of time. Outside of your reference, I think of how lobotomy was once a form of care we wouldn't even consider today, and in fact has been banned in countries throughout the world. In this debate, I have wanted to replace the misleading terminology gender-affirming care, especially as it relates to children, because 1, it replaces the biological reality of sex, and 2, because it falsely suggests that using the term affirming that there is anything good going on here. There are only 2 sexes, boys are girls, or boys are boys, yet girls are girls, and one cannot become the other. In fact, and especially when it comes to children, it seems to me that gender-affirming care is better described as sexual lobotomy. It is treatment that is fundamentally and permanently alters the sexuality and medical and psychological well-being of these patients. It causes irreversible sterilization and serious long-term medical complications and long-term reliance on pharmaceuticals. These treatments and surgeries are controversial medical practices that seek to change a person in a manner which is not actually achievable, and they will not withstand the test of time. Dr. Bowens, are there medical professionals in the U.S. and abroad already rejecting these surgeries as any form of serious medical care?
Yes, thank you for your question. And we are seeing an increase of medical professionals speaking out. Just this past week, there were 21 doctors that came out and said, we are very concerned about this. The own AAP, American Academy of Pediatrics, was referenced earlier, and 80% of their membership has been asking for a review of the literature, and they've been denied that review by the upper echelon. So there are, and I've listed many other countries, there are people who are standing up because they're seeing the harms done to these kids like Chloe Cole.
Can you discuss why referring to these treatments as life-saving treatment is so extremely misleading?
Yeah, it's misleading for a number of reasons, because for one, the whole impetus of the scientific method is that we're discovering things. We're supposed to be in a process of, is this the right approach or not? And this whole discussion about saying that it's life-saving automatically says there's no room for discussion, there's no room for scientific inquiry, because the science is settled, which is it's an amazing statement, because the suicide literature has been around far longer than the transgender literature, and the suicide literature is not conclusive. So we have a real right hand doesn't know what the left hand's doing in this case.
It seems to me what we've been living through for the last couple of years is a government that wants to suppress any type of speech that it disagrees with. And we're seeing that with the industrial censorship complex that we've been talking about. And it appears that that's exactly what's going on here. They want to stop the debate because they know that they can't win it. Dr. Bowens, my last question is what is the success rate of sex change operations?
Well, we have, it's hard to find longer-term data with children, but what the data that we do have, which is probably the most reliable data point available, is from a Swedish study, and it looked at over 10 years, which is really important because regret doesn't just happen a year after some sort of transition. And what you see is a suicide rate that's associated with 19 times higher than the general population.
Well, actually, there is a 0% there's a 100% failure rate for sex change operations, isn't there? Because it's not possible to change your sex.
That's right.
100% failure rate for these procedures.
That's right. You can't change your sex.
Thank you, and I yield back.
Thank you. The gentlelady yields back, and the chair recognizes the gentleman from New York for 5 minutes.
Thank you, Mr. Chairman. Mr. Minter, a federal court has stated that, quote, under the WPATH standards of care and endocrine society guidelines before puberty, treatment is focused on support for the child and family. Some prepubertal children may socially transition. No medical interventions are indicated or provided for the treatment of gender dysphoria in prepubertal children. Do you understand this to be a correct statement?
Yes.
Talk to the mic. Yeah.
It's actually not. Is the button red? Sorry.
Okay, there you go. My apologies. Yes, sir, that is 100% correct. Before puberty, there are no type of medical or medication interventions whatsoever. We're talking about transgender adolescents who've hit puberty and who would be eligible to be considered when it's medically appropriate.
What does the federal court mean in saying that, quote, no medical interventions are indicated or provided for the treatment of gender dysphoria in actually, you just answered that. What does the federal court mean in saying that some prepubertal children may socially transition?
Yeah, the only type of medical support or support offered to a transgender youth before puberty is to just let them be who they are. And I can't stress enough, this is about kids becoming someone they're not. This is about kids being who they are. So just allowing them to live with a name, clothing, etc., that reflects who they really are. And it's remarkable. They found that when research has found that when children are supported in that way, they are indistinguishable in terms of their mental health outcomes from non-transgender kids. They're just as healthy and really thrive when they get the support, that simple support that they need.
Thank you. Mr. Minter, what have courts said about laws that restrict transgender individuals' access to medically necessary care?
That they severely burden parents' fundamental rights to make medical decisions for their own children, and that they're blatantly discriminatory, that they violate the guarantee of equal protection because they do something that has just never been done before in this country, which is single out a particular group of people, transgender young people, in order to deny them medical care.
Thank you. Mr. Minter, a federal court has stated that, quote, the risks of gender-affirming medical care are not categorically different than the type of risks that other types of pediatric health care pose. For many adolescents, the benefits of treatment greatly outweigh the risks. Do you agree with this statement?
Absolutely.
What are the benefits of receiving gender-affirming care?
They're enormous. They produce positive mental health outcomes for these young people. They dramatically improve their quality of life. They do better in school. They develop positive social relationships. We heard that with Ms. Reynolds' testimony. Their relationships with their family improves, and their gender dysphoria is alleviated, and any depression, anxiety, suicidality is dramatically reduced. There's a study from 2022 that found a 73% reduction in suicidality among kids who had received this treatment.
Ms. Reynolds, thank you very much for being here today. Is there anything about you, your son, and other families like yours that you think the subcommittee and the American people should know?
I would like to just add one thing, if I could, and that is that with the sports debate, I just want to share my son's process with that. So, as I mentioned, he was the only girl on the boys' team for many, many years when he was a child, and when he transitioned, he completely dropped out of playing sports altogether. So that left a big hole in his life. That's nothing that he did anymore, and it was because he felt the pressure from all of this kind of political discussion around this, and dropped out completely. And I think that story is probably way more common than the isolated cases.
Thank you, Mr. Minter. What would you say about what we heard from Ms. Cole about her experience with gender care and her unfortunate experience?
I thank her for sharing that story and how I would respond. I think the most important thing to understand, that story is the exception, not the rule. Vast majority of young people who receive these treatments are getting them after careful assessment and because they really need them. This has actually been studied. We know that 98% of young people who receive these treatments continue to receive them into adulthood. I think what that reflects is the care behind these standards of care and the assessment process and the care with which gender specialty clinics in this country are providing this care.
So she is part of the 2%?
Apparently so.
Thank you. My time is expired. I yield back.
Gentleman's out of time. Thank you. The chair recognizes the gentleman from California for 5 minutes.
Well, I wonder first if Ms. Cole would like to respond to that.
I got to see a trans-identifying child who had a positive outcome with their transition. And the reason why most children who are affirmed continue on to transition, either as adolescents or as adults, is because once you've either socially transitioned or gone on blockers or started the other interventions like surgery or hormones, it's incredibly difficult to go back. The social ramifications are...
It's irreversible, and they have no choice at that point, is what you're saying.
in every single way.
There are two aspects to the question. Let me dispose of the first one involving sports, the fairness of allowing biological males to compete against females in sports. The second is a more complicated one, whether children should be subjected to irreversible transgender surgical or chemical procedures at all. But Ms. Scanlon, can you tell me if a female claiming to be a male has ever dominated in men's sports?
No, and actually in my league, there isn't two instances where a female athlete transitioned to the men's side.
So this is very much a one-way street.
Yes.
It's biological males competing against women dominate those sports. There's not a case of a biological female going transgender and dominating a male sport. Am I correct?
Yep, you're correct. And it's obvious that would be the case because...
Well, if that's the case, then simply this is an attack on the integrity of women's sports. And I wonder why my Democratic colleagues, who often posture as feminists, can't see this plain truth. Ms. Scanlon, what would be wrong with simply allowing transgender men and women to compete in their own sports competitions while we preserve the fairness of women's sports?
Yeah, I believe all individuals should have a right to play sports. I think sex-based categories make the most sense.
So transgender males should be allowed to compete with other transgender males in their own sports category. Nobody's got a problem with that, I think.
Yeah, if that's what governing bodies decide is the fair solution, then I'm for that. I believe that female spaces should be protected in female sports teams.
Now the more weighty question is who should make the decision to subject a child to such a procedure on behalf of that child?
Nobody.
Well, long before governments existed, there were mothers and fathers who had children. So the family is the most fundamental governing unit. It's established by nature itself. So I think it therefore follows that parents have a fundamental natural right to raise their children according to their own best judgment. It can't be absolute, of course. You can't kill them. You have to feed them and clothe them and shelter them. And society has a role to play in being sure that you do. But it's intrusions into the decisions of parents over the raising of their children. That needs to be very cautious, very limited, and very humble. Now, the ranking member in her opening statement makes this point, once you strip away all of the partisan rhetoric, and it seems to me that there are two issues here. The first is the effort in states like California to bypass parents' judgment and subject their children to transgender procedures against the parents' judgment, or even to hide this from the parents. That's going on in California right now. So I want to be sure I understood the subcommittee's ranking member correctly. It sounded like she, too, opposes government replacing parents' judgment over the decision on transgender procedures for their children. Am I correct on that?
That's you, Ms. Scanlon. Yeah.
Am I correct on that? I yield to the gentlelady to answer.
I'm sorry, I was...
It sounded like you oppose government replacing parents' judgment over the decision of transgender procedures on their children. Am I correct on that?
What I said was that parents have the ultimate right to make the decisions concerning appropriate medical care for their children.
I think we're in agreement. We can take that off the table. Both parties oppose the government, any government, making decisions over whether a child will be subjected to transgender procedures contrary to the wishes of the parents. Do I understand that correctly?
I believe that's generally the legal standard.
Okay,
yes.
that's great. Then we
Dispute
need to
is
take
over what is appropriate, apparently.
If both parties support a law that forbids performing these transgender procedures on a minor without the full and informed consent of the parents, then, Mr. Chairman, I believe we should advance such a bill right away. I think that would address the fears that I hear from a lot of parents that their desire to protect their child is at risk from various state governments like California who are trying to usurp that decision. We have complete agreement on that.
I think you're
we should move that
mischaracterizing
bill
the
today.
complete agreement.
Well, I thought we had just arrived at that agreement until it comes down to actually doing it, and then you seem to have a change of heart. But, Mr. Chairman, let's put that to the test. I see I'm out of time, but I think the sooner we move that, the better.
Very keen observation. The chair now recognizes Ms. Ballot, the gentlelady from Vermont.
Thank you, Mr. Chair. I want to start by saying these issues are difficult for most Americans to talk about. And I want to bring us back to the basic dignity and humanity of all Americans, full stop. Ms. Reynolds, I really appreciate you being here today. I, too, am a parent, and I know that I would do anything that I could to get my children the care that they need. And implied in what you've said is that that journey was not always easy for you. And I'm wondering if we could bring it back to the experience of real parents, real Americans right now who are trying to wrestle with these issues. Just tell us a little bit more, if you could, about your experience of trying desperately to get your child the support that you felt like they needed and to serve, and you didn't always know what that was.
So when my child came out as transgender, there was not sort of the hysteria that there is now about this. So there was not a lot of information. We didn't know anyone. We didn't know other parents. We didn't know other kids. So if you can imagine late nights on the internet trying to find any information, lots and lots of tears, lots and lots of discussions with my husband. What are we going to do? How are we going to support our child? And then we sort of put to the test the social transition, and then we spoke with experts, right? And we took our time and we learned and we grew. And as our child matured, that sort of changed things too. It was painful. I don't want to, I sort of don't want to focus on the negative of all of this, but it was extremely painful for us. It wasn't an easy choice. It wasn't anything that we took lightly. We took this extremely seriously. We were trying to get it right.
Yeah. And so is it fair to say that you tried to put the needs of your child at the center of all the decisions that you were making, difficult decisions in the face of a lot of stigma, a lot of misunderstanding, and you said recently the hysteria around this. And does the added stigma make it more difficult for parents in this situation to have the courage to stand up for their children? Like, what is that like when you feel like you are trying desperately to do the right thing and you're hearing all of these voices that you are not being a good parent?
It's absolutely heartbreaking, actually. I've spent my entire career trying to help people, particularly children. That is what I do. And to sort of be looked at as a child abuser or, an indoctrinator or something like that, it's extremely painful. It just adds a whole other layer to this. It feels very hateful and divisive.
I really appreciate you saying that, because I think there are a lot of parents across the country right now that are trying their level best to do right by their children. And this kind of heightened hysteria around this issue is making it very difficult for them to do that. So I wanted to bring this hearing back to basic humanity and dignity, because I feel like we have gone astray. That's the first thing I want to say. So thank you for being here. For Ms. Cole, I also want to thank you for being here. I'm very sorry you feel like you didn't get the care that you needed and deserved. Mr. Minter, you're welcome. Mr. Minter, if you could, talk to us about how gender-affirming care, what does that look like for young kids? What are we talking about when we talk about gender-affirming care for young children?
For young children, we're simply talking about parental love and support, not trying to change the child, recognizing that the child is transgender and allowing them to be who they are, and encouraging others, family members, to do the same. It's really just loving and supporting a child.
I really appreciate that. Again, let's bring it back to the basic humanity and dignity of all. The last thing I want to say is, in his opening statements, the chair said there's no such thing as gender assigned at birth, and I just want to be on the record here of standing up for the 5.6 million Americans who are intersex, and actually that's exactly what the experience that they had was. They were having their gender assigned at birth, and they are Americans too, and they are trying to navigate this. There are atypical chromosome patterns, gonads, and genitals that do not fit typical binary notions of male and female. That does not make them less American or less legitimate or less worthy of dignity and respect. I yield back.
Gentlelady yields back. The chair now recognizes the gentleman from Texas, Mr. Hunt.
Thank you, Mr. Chairman, and thank you, brave ladies, for being here today. I greatly appreciate it, and I admire your bravery in these times. Many of my colleagues on the left like to discuss gender-affirming care and claim that puberty blockers and hormone therapy and sex reassignment surgery are the only ways to treat gender dysphoria. Once a child expresses a feeling of gender dysphoria, instead of questioning the root cause of that feeling, that child will more likely than not be on a fast track to gender reassignment surgery, or otherwise known as genital mutilation. But I want you to imagine something. What would happen if we affirmed every thought that our children have? I'd like to show you a food pyramid. Now I know what you're thinking. This is not the FDA's approved food pyramid, although many of you probably wish it was. This is the food pyramid according to my 4-year-old and my 2-year-old daughters. And by the way, in the Hunt house, we don't do Ben and Jerry's. It's Bluebell only. If my children had their way, they would have ice cream for breakfast, lunch, and dinner, and for every single meal in between. Oh, the wisdom of children. But in a sane country, we know that children are mature enough to make adult decisions that will impact the rest of their lives. That's why we have parents. Children cry for ice cream, but as parents, we have the wisdom to know that ice cream is not in their best interest, particularly their long-term interest. I want to thank my parents, Willie and Diane Hunt. They had 3 children. All 3 of us went to West Point. All 3 of us served our country. All 3 of us earned multiple master's degrees from Ivy League schools. Do you know why? Because my parents did not give in to the thoughts of an adolescent Wesley Hunt. I am a United States congressman because my parents didn't listen to me when I was 8 years old. They raised us. They cared for us. They taught us the ways of being successful people. As an adult, you could do whatever you want with your body and with your own money. You're mature, you're fully grown, you can make adult decisions. I'm a combat veteran. I fought for the right for you as an adult to make your own decisions, but in my opinion, children are a different story. It is our obligation to protect them. When it comes to gender dysphoria in children, many in the American medical establishment have absolutely lost their minds. A child will tell their parent they have thoughts of gender dysphoria, and the parent may take that child to a doctor. But the doctor, instead of questioning the root cause of the dysphoria, will instead affirm the child's thoughts and proceed with gender-affirming care. But as many as my colleagues on the left want you to believe, there isn't widespread agreement on how to treat gender dysphoria. I can assure you that child mutilation is not the answer. In fact, in Finland, Sweden, France, Norway, and the UK are reversing course and asking questions. In the UK, their only national gender clinic for children shut down last year by court order. What do their doctors know that our doctors don't? I'm sorry we're here right now. I'm sorry, Ms. Cole. We failed you. Ms. Scanlon, my daughters are going to watch this because you have become their new hero. And I can assure you that my 4-year-old and my 2-year-old daughters will not change in front of biological men. This is ridiculous. I don't care what party you are a part of. If you think that we are all equal and the same biologically, you've literally lost your mind. And when my 2 daughters work hard in the sport, work hard in their craft to be the best that they can be amongst other women, they will compete against other women. I owe Victoria and Olivia and every other young lady in this country that. If you think I'm wrong, I am not the problem. I can assure you. We have an opportunity in this country to get this right in 2024 so we could stop all of this foolishness. But I cannot thank you ladies enough for bringing this up. I apologize that we live in America where this is happening. But thank God for the American spirit fire, and thank God for brave women like you, because it's brave women like you that are going to turn the tide so that future women won't have to suffer in the same way that you have. God bless you. Thank you so much for being here. I yield back the rest of my time.
Thank you. The gentleman yields back. The chair next recognizes the gentleman from Tennessee, Mr. Cohen.
Thank you, Mr. Chair. First, I'd like to quote Judge Moody from Arkansas, a federal judge. Thank you. He said the diagnosis of gender dysphoria is made by a clinician who assesses whether a patient meets criteria based on a clinical interview, the clinician's observations of the patient, and the reports of the minor's parents. This is how diagnosis of other mental health conditions are generally made. Gender dysphoria is a serious condition that, if left untreated, can result in other psychological conditions, including depression, anxiety, self-harm, suicidal behavior, and impairment in functioning. So these things need to be discussed and determined in a scientific manner and a logical manner, not emotion, not behavior and attitudes that appeal only to voters and to try to gain votes at the ballot box. This should be done responsibly. Transgender people have been around for a long time, and they have rights, and they need to be respected. I read Ms. Scanlon's testimony. I wasn't here to hear it, and I think Penn didn't deal with your situation like they could have and should have in putting up some type of different barriers in the women's area of the locker room. But that's another issue. But things should be dealt with in a different way. This is an easy way for people to try to get points. Pick on a minority group that is the most minority and least understood in our country. And it's gone on for centuries. 100 years ago, it was African Americans. Later, it was Hispanics. Then it was gay people. Now it's transgendered people. Find a group that is not understood and is easy to use to gain political power. It is bad for politics. It's bad for people. Should use science. Parents have rights in raising their children. Athletes have rights. There's a connection. We need to figure out the right answer. And to get the right answer, we need to ask the Medical Association and the Psychiatric Association to choose the people that come before us to testify and give us their opinions on the right way to deal with this issue. Not each group picking people that are favorable to them to put out divergent issues, but people who are experts based on the AMA and the American Psychiatric Association and maybe another association similar, where they pick the witnesses and send them to us to talk about the issue and to suggest a response that would be both fair to the transgendered parent, the transgendered child, and the society at large. The Republicans didn't want vaccines and face masks, and they argued that parental rights were sacrosanct then, and parents had a right to direct health care decisions for children. Well, a lot of people died. Tens and hundreds of thousands of people died because they didn't get vaccinated. In gender-affirming surgery, Republicans think the government should make these sensitive decisions. Not necessarily the case. They also believe Americans only have access to health care if their health care decisions match Republican radical beliefs. Republicans fought against the Affordable Care Act. They fought and refused to expand Medicaid in states, leaving millions without health care coverage, 120,000 in my state, Tennessee, not getting health care coverage when the federal government would fund it. They passed countless abortion bans depriving women of safe reproductive health care. They've spread misinformation and tried to undercut medical experts during the COVID pandemic, particularly in Florida. And now they're trying to limit gender-affirming care for transgender youth. By limiting access to health care, wedging their right-wing ideology into the exam room, and substituting their personal beliefs for the professional judgment of doctors, they are causing needless suffering. In the past two Congresses, I chaired this subcommittee. When the Republicans took control, they changed the name, which used to be the Constitution, Civil Rights, and Civil Liberties Subcommittee. They changed it to Constitution, I imagine with a small c, and limited government. Civil rights and civil liberties were out the window. I was disappointed, not totally surprised, that civil rights and civil liberties were removed. What I didn't understand is, however, this has anything to do with limited government. This does not have anything to do with limited government. There's nothing limited about asserting the preferences and beliefs of federal legislators into individual health care decisions about young people. It's intrusive and it's dangerous. I yield back the balance of my time.
The gentleman yields back. The chair now recognizes the gentleman from South Carolina, but first seek unanimous consent to allow the gentleman from Florida, member of the full committee, to participate and have the time waived to him for the subcommittee proceedings.
Mr. Chairman, I object. No, I withdraw the objection.
Thank you. Thank you. And the chair recognizes the gentleman from South Carolina, Mr. Fry.
Mr. Chairman, I'd like to yield my 5 minutes to the gentleman from Florida, Mr. Matt Gaetz.
Thank the gentleman for yielding. Ms. Scanlon, we just heard my Democrat colleague, Mr. Cohen, say that your circumstance could have been fully resolved if we'd have just had some barriers up in the women's showers. Do you think that that's a sufficient way to resolve what we're dealing with here?
I think by Representative Cohen admitting that we need barriers acknowledges there are biological differences between men and women. And by acknowledging that we need to have private spaces that are separate from each other, why can't we just use the locker rooms that we've always used, the men's and the women's? If you're acknowledging that we need protection and privacy from these men, then you're acknowledging that the locker rooms we've always used are the correct ones.
My next question is for Shannon Minter. Are you familiar with the changes in law recently in Washington State regarding transgender youth?
Yes.
And as I understand it, it used to be the case in Washington State that if a youth showed up at an emergency shelter, there was a legal requirement to notify the parent within 72 hours in the absence of some abuse or neglect. Is that your understanding of what the law was then?
I believe that is correct.
And then the law changed, where now in Washington State, if someone shows up to one of these shelters who's a minor and says that their parents don't agree with them changing their gender, that the shelter no longer has to notify the parents within 72 hours and can instead notify a government authority. Do I have that right?
The parents will be notified. There's no question about that. This simply allows for a delay in order to allow them to investigate to make sure this child is going to be safe. There's no question that the parents will be notified.
How long should parents have to wait, not knowing where their child is, while a government process is playing out to make a gender determination?
There's no reason to treat these situations with transgender young people who may be in danger or at risk of abuse at home any differently than we would treat any other child, where we have reasonable basis to worry about that and to investigate that.
But it does treat them differently.
A short delay to protect the safety of young people is always warranted.
But how long is the delay? How long do you want a parent not knowing where their kid is because the kid says they want to change their gender? Just tell me how long a delay is you think is appropriate.
I want authorities to treat these kids with the same care they treat all other children.
No, but
it will be a short delay, and the parents will be notified.
Because you won't tell us how long a delay. So if you're watching this, just imagine you're that parent and you don't know where your child is. And the law now says there's a 72-hour period where the shelter has to notify you in that 72-hour period for any child of any gender or any circumstance is a period to investigate whether there's abuse in the home. But beyond that, beyond 72 hours, you got to tell the parent. And so it's really important to understand here what the proponents of radical gender ideology want. They want to stand between a parent and a child on these important decisions. And I don't think it's abuse if a parent says, I'm not going to get my child gender blockers. And it's odd to hear you advocate for the law because just moments ago in testimony, you said, and I wrote it down, parents have a fundamental right to make health care decisions regarding their children. But if in Washington state today, the parent makes the decision that they're not going to provide that gender-affirming care, what it does is it unlocks for the government a window of time to keep the child away from the parent and to not tell the parent where the kid is. Oh, please, get over yourself. What's terrible is when you have this incongruent desire of the government to restrain the ability of parents to parent. And I can only imagine the terror that a parent must go through not knowing where their child is. So I think that's really challenging. We've also seen in the state of Alaska, Title IX, which was established for girls' sports to be used as a justification to socially transition a child against their wishes. Ms. Scanlon, as a beneficiary of Title IX, as a female athlete, do you think Title IX should be used in that way?
Absolutely not. Swimming did a lot of really good things for my life after I'm a sexual assault survivor, and swimming was one of the only things that I had to keep me going when I was struggling with that. And to think about young girls that are not going to be given those same opportunities because Title IX is being reworked and rewritten for these new people that have different definitions of what a woman is.
Yeah, I'm against
disturbing.
I'm against transitioning children against the will of their parents, and I'm against transitioning Title IX away from an asset for women's sports to this strange social justice cause that is deeply misguided. Thank you, Mr. Chairman. I yield back.
Mr. Chairman, I'd seek unanimous consent to introduce into the record an article entitled, "No, Washington did not just pass a law allowing the state to kidnap and transgenderify children."